Carolyn Weets, Kristin Huisenga with the Clinton Substance Abuse Council. Carolyn, we're going to talk with you first of all. A grant, a new program. Please fill us in on what's going on with the Substance Abuse Council.
Yeah, so this is a grant that's funded by Iowa Health and Human Services, and it specifically is aimed at reducing prescription drug misuse with our youth, so ages 12 to 25.
So it's the Strategic Prevention Framework for Prescription Drug Misuse.
That's right.
How did you get involved with this, and how did you get the grant?
So Kristin can better answer that. So Clinton Substance Abuse Council is the one that applied for the grant, and then I was hired to help facilitate that grant.
Okay, Kristin?
Yeah, we were able to apply for the grant based on need. So basically in the state of Iowa, they looked at counties that had kind of the highest need or misuse hospitalization rates regarding prescription drug abuse. And Clinton County was in that top half for the eligible counties, and we were able to apply for and receive that funding. So it's a 4-year grant. So this will be a multi-year project.
All right, very good. And again, Carolyn, you are the Strategic Prevention Framework RX Coordinator.
I'm the project coordinator. We'll just keep it simple.
Okay, there you go.
Project coordinator, yes.
Okay, very good. What do our local youth say about using prescription drugs, Carolyn?
Well, every 2 years we get information from the Iowa Youth Survey, and that survey asks the kids about things about their health. So everything from their nutrition to different habits and their opinions about substance use. And in 2021, which is the last time that we were able to gather data from this survey, the kids told us 2 things that should probably make us pay attention. One of them was they report that it's relatively easy for them to get their hands on prescription drugs that may or may not be theirs. And the second thing is that their perception of those drugs being potentially harmful is very low. So they don't think it's really that big of a deal if they're taking prescription drugs that are not prescribed for them or in a way that's prescribed for them.
Which, of course, is not right.
That is not right. No.
Now, this survey, you said 2021, was it to all grade levels or a specific grade level?
Specific. Yep, so 6th, 8th, and 11th graders are invited to take this survey, and right now they're getting ready to take it again. So our local school districts, many of them have opted to participate. We've been working closely with them. Parents should have been receiving consents in their electronic consents that they can let their kids take this survey. And it's really important because it helps our health department and everything. We gather data so that we know where we need to direct programs. So what are the needs in our county?
You kind of touched on it a little bit about they were saying that it was easy to get these drugs and they didn't think it was harmful. But what are some of the other things you're looking for in that survey, Carolyn?
So we're looking to see what their opinions are in general about not just prescription drugs, but they are looking at marijuana use and alcohol use, and that way that we can focus our efforts on changing perception. If they're have a misconception about something, just like the prescription drugs, we want to be able to focus our efforts on that and help educate them. And one of the most important components of that is our parents talking to their kids and having open and honest conversations with them.
I found it interesting that the grade levels were 6th, 8th, and 11th. Of course, 6th and 8th, they're both middle school youngsters here. I was wondering why not 5th, 8th, and 11th. Kristin?
So that's been established. The Iowa Youth Survey, as far back as we have in our office, which I think is like 1999, those have been the grade levels. So people that are experts in this have determined those were the best grade levels, and we kind of just followed suit with it.
Okay, very good. So what does prescription drug misuse look like in Clinton County?
So we know in Clinton County, which follows a national trend, that roughly half of illicit drug misuse, or sometimes that's called street drugs, started with prescription drug misuse. So things like prescriptions for pain medication, anxiety, or ADHD medications. So just to be very clear, these medications they have a relatively low propensity for addiction if they're taken properly, so as prescribed, right? We need pain medications for anxiety, medications for ADHD. It's when, especially young people, they kind of have a perception that they can't be harmed by things. And when they start to misuse these, that's when we see addiction problems. Sometimes people can't get their hands on the prescription medication anymore, so they might turn to street drugs or illicit drug use.
Yeah, I can imagine they think they're 10 feet tall and bulletproof,
Right.
as the song goes.
Right.
So what can community members do to help reduce prescription drug misuse, Carolyn?
Okay, well, the first thing is talk to your kids. So they know a lot more than you think they do. And just in speaking with kids, as I'm doing outreach and that, they have some really important questions and they're listening to you. And parents have the most influence on their kids. But there's 3 steps that every community member actually can take: grandparents, parents, caregivers. First of all, we want you to monitor your medication and your child's medications. Know how much medicine you have on hand and how much you should have on hand. The second thing is to secure those medications. So either in a safe, in a locked medicine cabinet or a closet, something like that, so that it's completely out of reach for anyone that comes into your home. And the last thing is disposing of your medications properly. So when you no longer need a medication, you got a medication for pain 6 months ago, you don't need that anymore, don't throw it in a drawer and just forget about it, right? We have receptacles at almost every pharmacy in Clinton now where you can just bring any medication in and put it in that receptacle. We also have coming up on October 28th from 10 to 2 p.m. at the Clinton County Courthouse. They're going to be having a vape and drug take-back day, and it's a drive-through. So police officers will be there to take any substances that you have hanging around, and they'll dispose of those properly for you.
Okay, so that'll be October 28th at the courthouse. Very
Yep,
good.
10 to 2.
Okay,
Right?
want to
Yep.
thank you both for coming in. Kristin, there was something you wanted to bring up. You talked about AARP, or what was that? No. Nope. Okay.
No, but we do have some ways that parents can get involved.
Okay.
And so that is one thing that we needed to talk about real quick.
Okay.
Is that we're looking for some parents and caregivers to get involved in a work group locally to help us reduce prescription drug misuse on our kids. So they can either contact me. Our office number is 241-4371. Or they can go to csaciowa.org. That's CSACiowa.org.
All right. Anything to close with, Kristin? All right. You probably said AARP because you were looking at me and you know that I'm a member of AARP. I want to thank you both for coming in this morning.
Thank you so much.
Fall is a great time to enjoy a round of golf, and the perfect place is Valley Oaks on Harts Mill Road, Clinton. Seniors, get out early and get in 18 holes with cart before noon for only $25. Valley Oaks also features a twilight special after 2 p.m. and of course take advantage of Wild Wednesdays with savings on golf and cart. For more information and for upcoming events, be sure to like them on Facebook. Valley